Well, Queensland, we did it. Today is an historic day. The day that 80% of us were double dose vaccinated against COVID-19. It is 680 days since COVID first arrived here in Queensland, since we first declared a public health emergency. And achieving that target, that 80% target, means we can open our borders finally on Monday at 1 a.m. and we can reward the 80% of us who are double vaccinated with those freedoms that we have outlined, the ability to go out, enjoy ourselves at Christmas without any of the restrictions that we've become accustomed to over the last 680 days. It's still a little bit patchy across the state, and so we have a message for some regions, especially the Gold Coast, where we would expect to see COVID cases first. On the Gold Coast, they're still sitting at 76.5% vaccinated, and between now and coming weeks, we really need to see more Gold Coasters come forward and get both of their vaccinations. I want to thank and congratulate and give credit to the health workers of our state. The pharmacists, the GPs, of course, all of the fantastic staff of Queensland Health, everyone who has been involved in this vaccine rollout. It is an incredible result. We can also announce today that it's a double donut day. No cases of COVID in the community or in quarantine. And while of course that's worth celebrating, that's an incredible result, it might be one of our last. From next week, we should expect to start seeing COVID cases, and we should have confidence that our high vaccination rate, as well as our ongoing public health measures, will keep people safe and will ensure that our hospitals can treat those people who get COVID and need treatment. Of course, we want to keep it up. We want to keep going. We want Queenslanders to keep getting vaccinated. We want to surpass that 90% target. And of course, we want people to go and get their boosters as they're required. Where else would you want to celebrate that kind of milestone than here in this warehouse that will eventually be the manufacturing facility for Vaxxus? Wouldn't it be fantastic if next time we need to vaccinate our whole population really quickly, we could vaccinate them using a platform, a technology developed in Queensland and manufactured here in Queensland, right here at Hamilton North Shore. We're converting this warehouse into a state-of-the-art manufacturing facility. There's 80 jobs in construction, but once it's up and running, there will be between 110 and 140 highly skilled Queenslanders working here at Vaxxus, creating a vaccine technology that is quick and needle-free. It will be easier to transport. It will be able to deliver a wide variety of different vaccines without the level of skill currently required to deliver the syringe vaccines that we've all gone and got this year. Who knows how many of those people who aren't yet vaccinated is because of their fear of vaccines and syringes, and this delivery technology will of course be much more convenient, much more suitable for those folk. Once it's up and running, they'll be producing 300 million vaccines here in this, what's currently an empty warehouse. And just think about that. Our fantastic health workers have delivered about 7.5 million vaccines this year to achieve that 80% goal. That means that Vaxxus would be able to produce that many vaccines right here in Queensland in just 9 days. Isn't that incredible? Supporting Vaxxus is a key part of our economic recovery plan. It's all about creating the jobs of the future as we recover from the COVID-19 pandemic. And we're doing it all over the state, including here at the North Shore Priority Development Area, where we are able to support businesses with land and facilities as part of the state government's economic recovery plan and our wider program. And of course, it's really close to where in 2032 we'll be hosting all of the Brisbane-based athletes for the Olympic and Paralympic Games. So it's all happening right here at North Shore Hamilton. Angus and Angus.
Hi, I'm Angus Forster. I'm the Chief Development and Operating Officer at Vaxxis, and firstly I'd like to thank the Deputy Premier, Dr. Stephen Miles, and the Queensland State Government for sharing this vision of constructing our biomanufacturing facility right here in Brisbane. It's pretty hard to conceive it at the moment, but in about a year's time, the space will be filled with state-of-the-art clean rooms for vaccine product manufacture, laboratories for R&D and testing, and also a medical device manufacturing space. I'd like to personally thank Sue Koch, Director of Biomedical Industry, Mark Turney, Executive Director of Industry Development, Michael Bucknell, Project Director, and Liesl Harris, Executive Director of Urban Industry and Development, for their support to Vaxxis in making this building and process happen. At Vaxxis, we're trying to transform vaccination. We believe in creating better access to vaccines around the world. And we're going to do that with a technology that makes vaccines more effective. It can generate more effective immune responses. It can remove the need for cold chain storage of vaccines. It simplifies vaccination and vaccine distribution and logistics, and also takes out the hesitancy associated with needles and vaccination. At the centre of our technology is a small patch that's covered in a dense array of small micro-projections, about a quarter of a millimetre long. Those micro-projections, when they penetrate the skin, deliver the vaccine to the abundant immune cells in the top layers of the skin. We place the vaccine onto the top of those micro-projections during that clean room manufacturing process. To use the product, to give a vaccine, the user simply needs to take the combined applicator device, remove the foil seal from the product, apply to the site of administration, press down, count to 10, and then remove and discard the product. They could also potentially recycle the unit as well. In the last 2 years, we've seen a tremendous growth in the number of vaccine projects that we're working on in Vaxxis. We have current projects with the Bill and Melinda Gates Foundation on measles rubella vaccination, and we're currently running a clinical study here in Queensland with the University of Sunshine Coast Clinical Trial Centre. We're also working with the US government on pre-pandemic influenza vaccine, US pharmaceutical giant, Merck, and another multinational for seasonal influenza product. With that growth in projects, we've had to expand our team from around 30 staff in 2019 to 80 highly skilled biomedical and pharmaceutical scientists and engineers. And by the time this facility is open in about a year's time, we should be at around 100 staff and should rapidly grow beyond 140 in about 5 years' time. Now, with that growth in staff and number of projects comes a need for additional infrastructure to enable commercialization and biomanufacturing. And this facility at North Shore will provide that. By the time it's complete, as the Deputy Premier mentioned, we'll be able to make 300 million products per annum from this one facility. And that should inject hundreds of millions of dollars into Queensland economy. And we're really excited that the Queensland State Government shares that vision for Vaxxis and the technology. We are a Queensland technology. The idea was born out of research at the University of Queensland in 2011. And Vaxxis has continued that development at the Translational Research Institute at Wollongabba for the last few years. We are following on a proud tradition of vaccine innovation in Queensland. Professor Ian Fraser and the late Dr. Jian Zhu on Gardasil, and more recent heroes such as Professor Paul Young and their work with the COVID-19 vaccine. We're also, by being based in Brisbane, able to continue to foster and grow our local relationships. We're really excited with work coming out of the University of Queensland with Dr. David Muller and his lab, who've been working with a spike protein COVID vaccine candidate and our patch technology. And they've published some fantastic data which shows that delivery of that vaccine candidate with our patch technology can produce more effective immune responses against a broad range of COVID-19 variants, and also in a preclinical challenge model, completely protect the preclinical model. So together with the UQ, we're hopeful of being able to start taking that into the clinic in early 2022, and hopefully in a few years' time be able to produce product at this facility to help protect Queensland and the rest of the world. So thank you.
Hanson Youngkin's project team have appreciated the opportunity to work with EDQ, Vaxxis and specialist consultants during the course of this year as the design for this facility has progressed. And now we enter the construction phase, where this existing structure will be transformed into specialist laboratories, engineering and a manufacturing facility. It's certainly pleasing for our business to be a business partner as part of the North Shore Hamilton transformation. and it'll be a project that contributes to the evolution of this area, contribute to local employment and the Queensland economy. Probably most importantly though, and certainly our project team are very excited about this, is to be in a small part to contribute to Vaxxis's journey in developing the needle-free technology. It's a technology that has world implications. So, challenging times, but a really exciting project, and now our team are generally enthused about the opportunities over the next 12 months as this project is developed.
Questions? Today is a day for Queensland. Today is a day for celebrating. It's not a day for claiming credit. Look, I can understand why the Prime Minister would want to claim credit for this, but the credit belongs to all of the Queenslanders who went and got vaccinated, and of course the health workers who rolled out the vaccination program. I guess in some ways that tweet giving us the data sooner than we would otherwise get it is kind of the first thing Scott Morrison's done to help.
DP, the former show and said Queensland hospitals could deal with COVID. Doctors are saying they can't. Which is it?
Our hospitals are well prepared. They are always well prepared for whatever comes at them, and in this case, that is a COVID wave. Will be a COVID wave that we should expect to start to see cases from next week. But we've had a long time to prepare, 680 days, and our hospitals and our health staff are fantastic. They've kept Queenslanders safe for all of those 680 days, and they will deliver to them the same kind of high quality care we're accustomed to as we start to see COVID cases in the community.
That is the case. Why is Cairns Hospital ICU struggling according to the acting show indication might have to be moved because it's not capacity there?
Well, look, it's not unusual for the health service to move people around based on where demand is and where supply is available. I'm not across the particular details at Cairns Hospital, but our health staff, our hospital networks are very, very good at determining what care people need, where that can be best delivered, and moving them around where that's required.
But if they can't cope with one case and not help them cope with 20, 30, 40 that way, you say
Well, look,
a few weeks or months.
as I say, I'm not across the details of what's happening in Cairns, but there is very detailed intensive care planning that has been put together and refined as we've seen the experience first around the world, and then as New South Wales and Victoria have experienced their outbreaks. And so I'm very confident that we have that ICU capability to deal with people if they require it. Of course, we now expect a much lower proportion of people to need ICU care because we've been so successful with the vaccine rollout. Look, I saw that plan. Much of what they have highlighted is already underway. We're investing additional hundreds of millions of dollars to open up additional beds. Key part of our COVID planning has been ensuring that we have additional capacity right through the system from ED all the way to ICU. And so I'm confident that while this will be hard for our health workers and our hospitals, this will be a challenge for them, but we are ensuring that they have the resources that they need.
Deputy Premier, can you see that there's a little bit of frustration being echoed today that the government said that we're opening at 80%, it's Thursday, we now have to wait until Monday, that there's a little bit of frustration being felt by people that are trapped behind the border. We haven't really opened at 80%.
Oh, this is a day for celebrating, and it's wonderful news that we have achieved 80%. Well, look, I don't think you could expect the police to have a system ready that could be implemented the minute the Prime Minister tweets a figure. It takes... Well, no, the official data isn't yet out, but the police and the systems required a number of days to get ready. We made a decision to provide a firm date, a fixed date, so that people could plan around that. I don't think that's too unreasonable. We also, given it was close to the end of the school year, we wanted to see the school year finished, which of course is tomorrow, and then borders will open on Monday. This is really the same approach we've had throughout. We've attempted to give as much certainty as we can while also making sure that our systems are ready and in place, and they will be ready and in place on Monday. As is always the case, our hospitals manage their triage. They ensure that those who need to be seen most urgently are seen most urgently, and that means that sometimes those who don't need to be seen as urgently may need to wait longer. In New South Wales and Victoria, as they've grappled with these very, very long outbreaks, they've had to cancel much of their elective surgery for much of this year. We've been able to continue to deliver that activity, those operations, which mean we're in a much better place as these cases begin to emerge. Well, we'll have to see how quickly the cases come and how quickly they spread, what kinds of case numbers we get to. But what we know is that because we have double vaccinated, what we know is that because we've achieved that 80% goal, so many Queenslanders now have protection. That will mean that less of them will get the virus, less of them will get sick, less of them will get very sick, and a very, very small proportion will need that ICU care. So the best thing we could have done for our hospital system, for hospital capacity, was wait until we hit that vaccination target. We're incredibly fortunate. I don't know of anywhere else in the world, really, that has been able to wait until they've double vaccinated 80% of their population before the virus starts to arrive in large numbers. Look, that data is available, and we can provide that. We know a number of regions have really picked up as we've highlighted our concern. The Gold Coast is a particular concern because we would expect to see the first cases arriving here in the southeast, probably on the Gold Coast, and that's why it's just so important that people get vaccinated, particularly as we head into the school holidays when lots of people will be travelling to and from the Gold Coast, lots of people will be out and about on the Gold Coast, so the risks are greater there, especially given that there's still a good number of percentage points less than the state average and well less than the numbers in Brisbane. Look, I understand that the Commonwealth has made that decision. That, of course, applies to Queensland, and any questions regarding it really need to be directed to the Commonwealth. That's a decision for the Commonwealth. Diplomatic affairs are a long way from my Office of State Development. Olympic infrastructure is. We've secured the hosting rights. We're getting on with the job of delivering the 2032 Olympic and Paralympic Games, and they're going to be fantastic.
What was your reaction to the PCCC report last week? Do you think government's throwing positions on that?
That's a matter that the Premier has said will be carefully considered by the government. We will look at that report when we come together again in the new year. The concerns raised, of course, are very serious, but also the CCC's role is very important and confidence in it is very important. So no doubt we'll consider it very carefully and there'll be more to say about it in the new year.
Frustrations of stakeholders in your portfolio, like the LGAQ, you've got this fairly damning report and there's going to be no decision until at least the new year.
Look, these are very serious matters. very serious matters that deserve to be carefully considered. The opposition leader might be able to deliver a soundbite the day after, but we actually have to govern and make decisions that matter. And the CCC is a very important institution, a very important pillar of how we ensure accountability and transparency in government, and also how we deal with high-level crime. And so I think it's entirely appropriate that we take time to consider that report, consider its implications, and consider what to do next.
Why did you intervene to back the dump in Ipswich?
We're supporting a recycling facility in Ipswich, Lydia. It's an integrated recycling facility. Unfortunately, though, there are currently some materials that the technology doesn't allow for recycling, and so there is a residual. The facility would be unable to be built without, or at least the company argue, that the facility can't be built without an ability to deal with that residual. And so all I've done is said that the state wants to have a look at that claim, have a look at whether this facility would help us achieve our recycling goals, have a look at whether they do indeed require that landfill capability, and also have a look at it in light of a range of other things. The waste levy is currently being reviewed. The Council of Mayors have recently released their view about how waste should be dealt with strategically across the region. And so at the moment, all we've said is that we will consider whether the state should reassess those approvals, and there'll be a decision on that then before we go on to do a proper assessment. That will involve a process whereby the public and other stakeholders can have their say.
And what was it that Evan Moorhead said to you that convinced you to reconsider this?
I've not discussed this matter with Evan Moorhead or with his lobbying firm.
Can we just look at this project here, not just to start, what's the funding and backing?
So the dollar amount I'm not across, but our support here is in the form of the facility within our priority development area. What we've said is that government will use all of the levers that we have to create jobs and get development here, and ensure that technologies developed here stay here. And the kinds of tools we have available are land, dollar incentives, planning approvals, and we are unashamedly using all of those to deliver projects like this one. This is obviously tragic. Every Queensland life lost is tragic, and tragic for the family involved. We should expect to see more floods. The advice from the Bureau is that many parts of Queensland are now waterlogged, and that means that it won't take a lot of rain to see flooding. And we just say over and over again, if it's flooded, forget it. It's not worth it.